Hi, everybody. Welcome this afternoon. Today's topic is going to be on the female pelvic exam. So, the objectives for our class this afternoon, at the end of the lesson, the learner will be able to interpret the guidelines for pelvic exam and pap smear, describe normal pelvic anatomy, recall the equipment that's needed to complete a pelvic exam, discuss the steps of a pelvic exam, and execute a pelvic exam on a model. So let's take a look at a case study. This is a very typical woman that might walk into your clinic in the afternoon. She's 48 years old and she presents for her well woman checkup. She has not been on birth control since her mid-30s and has 3 adult children. Her periods have started to become irregular almost every other month. There's no pain associated and it can last typically about a week. She continues to be sexually active and has not noticed any vaginal dryness. Her last pap smear was maybe 6 years ago. She can't remember, and she's not sure if she ever had an abnormal exam. She takes no medicine and has no other relevant medical history. So let's talk about the current guidelines that are out there. There are several organizations and agencies that disseminate guidelines for pelvic exams and pap smears, including HPV testing. The United States Preventive Services Task Force updated theirs last in 2018, and they recommend starting at age 21 to age 65 and not being indicated if you have had a hysterectomy. The American Cancer Society updated theirs last year, and they actually upped the age to starting PAP and HPV testing at age 25 through age 65, and also not indicated if you're a post hysterectomy. So the United States Preventative Services Task Force recommends from ages 21 to 29 a pap smear every 3 years. Over age 30, either a pap every three, primary HPV alone every 5, or co-testing every 5. And the American Cancer Society says at age 25, one of these methods is appropriate. Primary HPV testing every 5, co-testing every 5, or a pap every 3. So let's talk about a little bit of the normal female anatomy that we're going to be looking at as we do our external exam. I always like to think about the vulva and the vestibule as a clock. It helps me really identify landmarks. So starting at the 12 o'clock positions with the mons pubis, moving straight down to the clitoral hood and the clitoris. We always want to examine the labia of majora and minora for just general health and to make sure there's no lesions or erythema or edema to this tissue. Once we open the labia of majora, we are now looking at the vestibule, which is inside that tissue. Once we open that up, we're able to see the vaginal orifice and also the urethra, and we can really just examine the conditions of the tissues. Look at the urethra, see if there's any redness or swelling to it. Also, we can examine the Skene's glands, which are up by the urethra, and the Bartholin's glands, which sit more posteriorly in the vestibule. And then we move more internally. In the internal reproductive anatomy of the female, what we're going to be able to visualize with our speculum on exam is going to be the vaginal cavity and then up into the cervix and the cervical os. The uterus and the ovaries will be palpated with our bimanual exam. So what do we need? We need to know what supplies to use and to have ready prior to going into our patient room to do this exam. I'm going to show you a little video that I made. Thank you. So let's go back to our case study, right? Remember our patient that came into our clinic this afternoon. So think about how old she was. Think back to some of her demographics, right? How old was she? Exactly. She was 46 years old. So does that put her within that age range of the recommendations from both guidelines? Yeah, it does, right? 21, 25 to 65. So she definitely falls into the guidelines within the age range of someone who needs a pelvic exam and a pap smear and an HPV test. So does she need that? Does she need the pelvic exam and a pap smear? So yeah, right. She hasn't had one for at least 6 years, and that's maybe iffy-ish. So she certainly it is at her time, according to both guidelines, to have her Pap smear done. And should she have co-testing for HPV, certainly that co-testing every 5 years within that age group is acceptable. So on her well visit exam today, she certainly needs to have a pelvic exam, and we can do a co-testing, which will gather our Pap smear and do our HPV testing. So as our patient is getting ready for her exam, undressing and getting on the table, these are my references for this presentation. And now it's time to move into the demonstration, and then I'm going to let all of you practice. All right, hi everyone. We've moved into where our pelvis is and into the sim lab. So if everyone wants to kind of gather around so they can see what I'm doing, that would be great. I'm going to make sure my patient is comfortable and covered when we come in and have her scoot her pelvis down to the end of the bed. Make sure I have my light source so I can see good. And typically I put all my patients up in stirrups. We'll put my gloves on. Remember, the first thing we're going to do is our external exam. So I always tell my patient that I'm going to walk her through exactly what I'm doing. So I'm going to uncover your bottom here and put this sheet up on your abdomen, and I'm going to start my exam if that's okay. I'm going to tell her I'm going to be touching you and I'm going to feel you. Can you feel me touching your inner thigh? Yes. And I say I'm going to do my exam with a Q-tip. So if you feel something, it's just going to be my Q-tip moving the tissues around so I can get a good look. And as we talked about, I start at my 12 o'clock position at my mons pubis and work my way down, inspecting the skin, the labia majora, labia minora, separate that tissue, look at the vestibule, look at the urethra and the vaginal orifice, and just really inspect that tissue good. When that is done, I'll be moving in for the swab of vaginal secretions, and this is also if we need to do any sexually transmitted infection testing, we can swab at this time. So it is a plain cotton swab that I insert into the vaginal orifice. I just move it around inside the orifice approximately 3 to 4 times and take it out and lay it on the table or give it to my assistant. Now we're going to do the pap smear section of this next. I've chosen the small speculum for her, and I am left-handed, so I like my instrument that I gather my cervical cells in my left hand. So I hold my speculum with my right hand, and you might notice that you tend to want to do the opposite. So you need to practice with this equipment prior to using it on a person. So I cradle it in my hand, and between my pointer finger and my middle finger, I lay the bill of the speculum, and that helps keep it closed as I insert it. And then I control the opening and the closing of the bill and the locking of it with my thumb. So we're going to insert the speculum now to do your pap test. The speculum is inserted at a mild angle, and it's pointed downwards towards more posteriorly so that there's no pressure on the urethra. So the speculum is inserted, and then it is turned so the handle of the bill is up and down, and then I'm going to open the speculum and it locks in place. At this point, I'm going to visualize the cervix and the cervical os for any redness, lesions, or abnormal tissues. I typically will use the broom, which is the one device The point goes into the cervical os to get the endocervical cells, and the broom along the endocervical area that collects the external cervical tissues. So it goes in through the speculum. I put my brush in the os and I rotate it around approximately 4 to 5 times. It comes out and it goes in my specimen container where I swish it around at least 10 times so that the cells distribute through the tissue. I then unlock my speculum. You don't want to pull it out locked, unlock it. It will close it, and I'm again going to rotate it about 180 degrees, actually it's 90 degrees, and pull it out. Great job. I just need to do one more thing, and that's take a feel on the inside. At this time, I typically will change my gloves, but you don't have to if they're clean. You've noticed up to this point we haven't used any lubrication because we don't want anything inside the vaginal orifice that will change the consistency of the cervical cells. But since we've gathered all of our cells, I now can use a little bit of lubricant on my finger, and I typically stand to do this. I just tell my patient, the next thing you're gonna feel is my finger going into the vaginal os, and I'm gonna feel in the abdomen and see if I can feel your ovaries. So my pointer fingers goes vaginally and is anterior to the abdomen as I press down on her abdomen suprapubically, and then I move to the left side and around umbilical area. I will do a sweeping motion towards the pelvis to see if I feel the ovary, and I will repeat the same sweeping motion on the right side. At that point, my exam for my female pelvis with gathering my cervical tissues for my pap smear and my HPV are completed, and my patient can get dressed. Thank you again, and now you all can practice.